Yeah, hi, it's Brian Newman with the Spotlight of Business Owners show, and today we're thrilled to have Don Rice with the Don Rice and Associates LLC business. Hi, Don, how are you?
Hey Brian, I'm doing great. Thanks for having me on today.
Yeah, my pleasure. Yeah, so before we get into your business, if you can let people know a little bit about your background, that would be really helpful.
Yeah, not a problem. From New York City, if you can tell by my pictures in the back. I've been here in Arizona since 1994. I opened up my insurance agency back in 2004 in the health insurance world. I did individual, small group, and group health insurance benefits as a broker. And then in 2006, I jumped into the Medicare market, helping my mom in New York, and then realizing here in Arizona, it's just to help all these people here. So, diehard Yankee fan, Giant fan from New York, and married, a couple of kids, and just enjoying life here in Arizona. Golf
Oh,
as much as I
nice.
can.
Oh, wow. Yeah, so your specialty is Medicare, isn't it?
Hmm.
Yeah, so can you tell them basically what is Medicare and the various parts of Medicare?
Yeah, Medicare is the federal health insurance program for when people turn 65 or older. If they have certain disabilities, so if they've been on disability for 24 months, they're granted into Medicare irrelevant of their age. And then for people who may have end-stage renal disease, it gives them federal benefits. There's basically four parts to Medicare. There's Part A, which is your inpatient hospitalization, and there's no monthly premium to that to the government because you've paid into it all your life through your taxes. If you look at your pay stubs, it'll say Medicare, and there's a chunkier check going into that. Medicare Part B, there are all your other medical benefits. So if it's not inpatient, it's going to fall under Medicare Part B. So you've got doctor visits, labs, outpatient, durable medical equipment, your emergency rooms, ambulances, urgent cares, all of that falls under Medicare Part B. And there is a monthly premium to that, and that's based on your personal annual gross income, but that premium is paid to the government or Social Security. It has nothing to do with the insurance companies. So Medicare Part A is your inpatient, Part B are your medical benefits, and then there's what's called Medicare Part C, which is private insurance companies offer Medicare Advantage plans. Even though they're offered by the private insurance companies, it's regulated by the federal government. And then there's Medicare Part D, as in drugs. That is also offered by the private insurance companies, but regulated by the federal government. And all of these are the parts of Medicare as a whole.
Oh, okay. Wow. How long have you been doing this?
I jumped into the Medicare world back in 2006. I was already well into my health insurance agency, but my mom back in New York obviously was on Medicare. And 2006 was the big year because that's when they introduced the introduction of Part D, the drug plans. So because it became, and again, without getting into too much detail, but it became pretty much a mandatory type thing. My mom, I was helping her in New York, and when I realized the complexity of it, I said, here I am in Arizona. I'm already in the insurance world, the health insurance world. I said, I can probably help a lot of people here in Arizona because it's kind of like the retirement capital of the Southwest, so to speak.
Oh, yeah.
So I just knew if I got my certifications and everything, I can help a lot of people with Medicare. And since then, I've helped thousands of folks with their Medicare and retirement benefits.
Oh, okay. Yeah, I know, with the baby boomers becoming of age, yeah, you got to be very busy, I'm sure.
Yeah, well, through 2030, we should have a pretty constant market.
I know I just went on Medicare about 6 months ago, so I know I'm enjoying the benefits. It is nice. It's
We
really
should
nice.
talk after the call.
Yeah, okay. Okay. No, yeah, what's one thing you would tell people who are becoming of age, who are becoming 65?
Yeah, so if someone's turning 65, or if they're older, 65 or older, and they're coming off of employer group benefits that they've had, I mean, I have clients that are 71 years of age, but they're just coming off an employer group benefits plan. So I help them with that transition into Medicare. But the biggest thing I would tell those folks is if you're turning 65, you want to open up conversation at least 4 to 5 months prior to your birthday month, because there's just a lot of moving parts involved. There's questions like, okay, are you on employer benefits? Are you collecting Social Security income? There's a bunch of different scenarios that are involved, and everyone has a different scenario. So it's important to get the information on these folks so we can help educate them through the Medicare process, just what Medicare is, and then let them know that, because there's a bunch of different entities involved, what has to be done, the time frames, are there going to be penalties involved, which is why we want to open up 4 to 5 months early to avoid any penalties, and just evaluate each person's scenario individually so we can guide them in the right direction, get them educated. And a perfect example is, even if a husband and wife are both turning 65 on the same exact day, they could have different wants, needs, and budgets based on their individual medical needs. Because Medicare is not, there's not a family plan in Medicare. Everyone is an individual. So husbands and wives included could have completely separate needs to what they need to look for when they enroll into Medicare.
Oh, okay. Hey,
And
Don.
if I may add on to that, Brian, just on if they're part of an employer benefits group,
Uh-huh.
if they're past the age of 65, we really need to open up conversation early, because there's extra steps that have to be done with Social Security to make sure these people avoid those penalties if it's not done correctly when they leave their employer benefits and go on Medicare.
That's what I was going to ask you. Like, what if they miss that date when they turn 65? Do they only have one chance to go on Medicare?
There's one chance to go on to Medicare A and B, to avoid penalties for the most part. So if someone's turning 65, there's a 7-month window to enroll into Medicare, to primarily Part B, to avoid any penalties. That's 3 months prior to the birthday month, the month of their birthday, and then 3 months past their birthday month. So as long as they enroll into Medicare by the end of that 7th month, they would avoid any penalties.
Oh.
If they miss that time frame, now they're going to have, there's a certain time of the year that they can enroll on Medicare. And even if they get into that time of the year to enroll, the benefits aren't even going to start until a later date. So this is why it's so important for people to get educated prior to their knowing they're going to transition into Medicare, whether it's turning 65 or coming off of an employer group plan.
Oh, okay. Also, do you advise people to get a supplementary insurance to go with the Medicare?
Yeah, that's all part of the educational process. So once
Oh,
we finish our process to educate everybody, so this is what Medicare is, these are the different parts, and we take them through that. We gather information on the people, because they're going to have one of two roads to choose. They're going to be able to go down that Medicare supplement road, or also known as a Medigap policy. And if they go that route, it is strictly medical coverage. Medicare doesn't cover dental, vision, hearing, or prescription drugs, okay?
oh,
Again, prescription drugs are regulated by the government, but it's not covered. Then if they go the supplement or the Medigap route, they have to get a standalone drug plan, which is another part of the process, because if someone is not taking any medications, they'll say, okay, Don, why do I need a drug plan?
uh-huh.
Then there's ramifications and or penalties down the road if they don't choose one at the right time. They could be penalized down the road, and those penalties are from the government, not the insurance companies.
Okay.
The other side of the fence that people can choose is what's called the Medicare Advantage plan. And those are the private, they're issued by private insurance companies, but they're regulated by the federal government. And usually, a lot of times, those plans are like a zero premium. It includes their medical, it can include some dental and vision and hearing benefits, and usually includes their prescription drug plans. But there's a lot of pros and cons to both. And that's what my job is, to educate people on what those pros and cons are, to make sure we meet their budgets, their wants, and their medical needs.
Oh, okay. Yeah, so I want to remind our viewers, yeah, we're talking to Don Rice with the Don Rice and Associates LLC agency. Don, what's the best way for them to get in touch with you?
The best way to reach me is they can reach me at that phone number right over your right shoulder there, 480-551-7303.
Okay.
The email address is donrice@azinsuranceguy.com. And then my website is azmedicareguy.com.
Oh, okay. Oh, thank you. Yeah, so what separates you from other agents or brokers?
Well, I truly believe, because I've been doing this, I'm in my 15th year of doing this, so I consider
Oh,
myself very well versed, um, as well as I think the educational piece from what I've talked to other people I've talked to in regards to Medicare. A lot of people out there they're just talking about products that are going to fit these folks going on Medicare. My philosophy is that if people don't understand how Medicare works from the governmental side, it really doesn't allow them to understand what program to go with for their secondary coverages moving forward. So I think the key piece is making sure they understand Medicare. And as a Medicare and retirement specialist, we factor in not just their Medicare and their drug benefits, those would be prescription drug benefits,
okay.
but we also can help them with dental insurance, uh, extended cancer policies, different, anything. We take them from the pre-retirement years to the post-retirement years. And our primary goal is to give them the equivalent benefits at a lower price or better benefits at the same price, if not lower than what they're currently paying before the age of 65.
Oh, okay. Okay. No, so with this pandemic upon us, and it has been for quite a while, how has this affected your business?
It really hasn't affected it to date, because the government everything that's COVID related, the government's been taking care of anyway. So a lot of the co-pays have been lifted. Anything COVID related, for the most part, people haven't had to pay for.
Oh,
So
nice.
moving forward, we'll see. It's a rolling snowball, if you will. So we're just kind of taking it day by day. But to date, the government's been taking care of everything for the most part,
Oh, okay.
irrelevant who your health insurance is with or Medicare's with.
Oh, that's good to hear. Yes, Don, I was going to ask you also, um, yeah, do you meet with people or do you strictly do it over the phone or on Zoom or how do you,
It would be D, all of the above. So
okay.
when I'm with someone on the phone, I give them the option. I said, look, I'm more than welcome to meet with you face to face, and I respect all the protocols for COVID. I have my masks. I respect the 6 foot, the social distancing.
Uh-huh.
I carry the hand sanitizer with me in and out of appointments if they want to meet face to face. So that's up to there. If they're comfortable with that, I'm comfortable with that. I've done tons of Zoom sessions, one-on-one Zoom sessions with a husband or a wife or a couple of people. And then also we do seminars. So I've got a couple of virtual seminars that are coming up, that are free. There's no cost to join. And it's strictly going to be an informational seminar that's going to take people through what Medicare A, B, C, and D are, and then what kind of options they have. But it's a 35-minute seminar, and it's going to be very informative with a chat Q&A. And there I'll have a moderator working with me, so that person will be handling the questions as they come in through chat, and there'll be private chat, so people's personal information will not be exposed. And then I'll just be educating folks on that. So we'll have a couple of those coming up. The first one is October 22nd at 6 p.m. That'll be a virtual seminar. They can contact me to get the registration link. The next one will be October 24th, which is a Saturday morning at 10 a.m. And again, if they just reach out to me via email at donrice@azinsuranceguy.com or call me on the number there on the screen, 480-551-7303, I can get them the link to register for either of those events. And there will be more events coming up as the fall progresses. And then if I may, Brian, just speaking
Yeah.
of the fall, right now we're getting ready to get into one of the busiest times of the year for anyone on Medicare. October 15th starts the annual enrollment period for anyone who's on a Medicare Advantage plan, a standalone drug plan, or anyone who is currently on a Medicare supplement plan but may want to change onto an Advantage. there's a 7-week opportunity to do your homework, get educated, and see if you're okay where you're at, or to possibly change plans within that time frame to make it effective on January 1st. So it's a very, very busy time of the year. And if anybody has any questions on their Medicare, what to do, if they're okay where they're at, feel free to give me a call. I can always converse with them over the phone, answer any questions. And then if need be, we could schedule up a Zoom call or a one-on-one conference call.
Oh, okay. All right, great. Yeah, so yeah, done. Yeah, I just want to remind people one more time, yeah, to reach out to you for your Medicare needs. I know there's a lot of people turning 65, and Don can be reached at 480-551-7303. Don, so any final words of advice you want to give to the viewers?
Just anybody, if you're turning 65 or know anybody turning 65, or coming off of employer benefits past the age of 65, my biggest tip is don't wait until days before your Medicare is supposed to kick in, because because we're dealing with the government. So because the Social Security offices are closed, getting all of that lined up through websites and fax machines, even though they're still around, there could be glitches in the system. So this is why I highly recommend people open up the conversation 4 to 5 months prior to the date they know that their Medicare is going to be into effect. This way, if there's any glitches, we have time to educate. We have time to get the glitches worked out through whoever it may be, whether it's the Social Security. I have one lady right now who she had one name in her last name was incorrect. So her Social Security card was one letter off and it was wrong. So she just literally just changed it on her card. She went to file for Medicare and now it's a mess because it doesn't match up.
Oh, wow. Wow.
So 4 to 5 months, I say, is minimum to open the conversation to get things rolling.
Oh, okay. All right, well, Don, yeah, thank you so much for being a part of this.
Well, Brian, thank you for inviting me. I really appreciate it. It's good seeing you.
Yeah, thank you.